Hello, everyone. Welcome to our latest White Pod. I'm Stephen Blaine, your host with White Labs, an internet marketing agency that specializes in e-commerce marketing. I have our guest Howard here. Howard, feel free to introduce yourself and tell our viewers about your background.
How you guys doing? My name is Howard Rosen. I'm the CEO of Nova Insights. Quick background is I educated as an MBA, trained to run a Fortune 500 company. I was shocked and dismayed on graduation day that you don't start running a Fortune 500 company right away. So naturally, I had to do something with my time. So of course, I spent about 20 years producing film and television. And in doing so, it came across actually an idea on a communication platform based on some continuing medical education parts we were working on. And came across this idea that I sort of thought about in terms of better communication for patients and providers, which led me to getting to Health IT, which is 15 years now, and which built a company and a platform, with basically a cloud-based communication platform, which I now hold 8 patents. And during COVID, I thought, enough founding that company. Let succession kick in, and I've created the Nova Insights, which is
can you give me like a brief overview of
digital
your
transformation and solutions architect in the healthcare space? Well, sure. Really, the brand is really, it's sort of trite to say thinking out of the box. Let's say it's thinking without the box in terms of coming with ideas and perspectives. I did for myself, but for clients in terms of how you innovate within given parameters, but outside of the norm. The mathematics of what justifies what I do is 80% of innovation in any industry comes from outside that industry. And so I sort of brand myself as the guy who sort of has that purview.
So who are your target, who's your target audience, who's your target clients?
And provide innovation for my clients. It's been healthcare systems, clinical groups and providers. So I've worked from small, I've worked in the private sector and the public sector as civilian and military.
What is your number one service or product that you're providing at this point?
A lot of behavioral health predominantly. It's looking at how you take what exists, innovation. Of course, you're hearing AI everywhere, but it's really how do you take means of automating and taking rule sets and take away the mundane, the more automated processes that are very automatic. Use systems to manage that using basically robotic process automation and allowing providers, nurses, clinicians, techs work at the top of their license. So really using technology to make things easier for the clinical side to allow them to actually provide better care. At the same time, allow patients to provide more insights on themselves so you actually get more precise care.
What exactly inspired you to do all this?
Here's a pamphlet. Well, it's funny. The original concept came to me, again, we're still doing film and television, as I mentioned earlier, when I was expanded the company into the area of education and training. And one of my first clients was in the pharmaceutical space working in diabetes. And so this is 2005. And I sort of saw lots of solutions that were used, but hardly being used. Like 18 people are managing their diseases. So being a card-carrying, arrogant producer, I kind of went, well, dudes, all you got to do is come up with a solution that ties to people's lifestyle. And they'll be more interested in engaging and managing their lifestyle as opposed to solutions that push them away from what they used to do. And thought nothing of it. 6 months later, I was working with Universal McCann on a brand new cell phone. This is probably before your time, but it was the first clamshell called the StarTAC for Motorola. And I worked on the promotional campaigns for that. And talking to the engineers, they're saying, no, this is saying, you're not going to believe this, but one day we're going to have computer programs on a telephone. And we're all going, nah, you got to be crazy. No one's going to want to do that. And it said the first one's actually going to be weather. I go, you're not going to be able to tell the weather of the phone. You're crazy. And literally that evening, working on both the diabetes project and the cell phone, I kind of went to myself, maybe there's a way of using cell phones.
That's a great story.
I like diseases.
It. And how long have you been doing now?
My Odyssey. This is about 15, almost 20 years now, I guess.
That's amazing.
2005 when I first came up with the idea. And as I mentioned, since then I've been awarded 8 patents on these progressive ideas. That obviously went from cell phone to be very much a cloud-based. The concept behind that is take away the barriers of communication. So fundamentally, instead of telling people how they want to communicate, let them choose how they want to communicate, what's most comfortable for them. So the solution or the platform I developed at the time allowed patients to choose whatever device that they want. So it could be a cell phone, could be a tablet, could be a computer, could be a landline. And similarly, how they wanted to communicate.
And where's your target audience? United States mostly?
Like WhatsApp.
Okay.
And it happened instantaneously without an app whatsoever. So it's all instantaneous.
Okay.
It's been fundamentally the US. I've done some in Canada. We're talking in Europe now, but fundamentally it's been the United States. And so since then, since the succession of that company, I'm still on the board of the company, but I'm now on my consultancy expanding dramatically.
What activities are you doing to promote the business?
Putting on steroids, depending on the client themselves, or working with the client evolving new areas. It's a lot of thought leadership in terms of I do a number of keynote speeches throughout the year. I do there's actually a lot of podcasts that I'm invited to speak on. So the keynotes are either virtual or in real time.
That's great.
And I do a lot
what's
of
what's the future
writing.
plan? What's the plan? What's the plan ahead?
In this particular area? Well, the plan ahead is continue what I'm doing, but I've actually got something in the skunk works right now. Basically creating a more of a virtual healthcare stack, sort of taking everything that I've done and making it into a modular system so that a health system can pick and choose what they need when they need it, and at the same time be as engaging for the patient and the clinician. Because fundamental to all this is humanizing the experience. So it's not just bolting a technology on, it's actually doing it so it actually provides value to what the clinician needs, the provider needs, the patient needs.
Makes total sense.
They all have different needs.
I get it.
So it's sort of it's creating a system that sort of has that breadth, but at the same time has that same
I'm on that 100%. So what makes you
and
different?
Simplicity takes a long time.
Why are you better? What makes you different than your competitors that are doing a similar thing that you are? I know you have the patents, but what makes you different and better?
I think the big difference, frankly, is, for lack of a better term, the trench warfare. So I sort of started as a solopreneur and an entrepreneur and built a company. So I'm working with clients from the ground up and have a team that has the breadth of experience, having worked at both the clinical side, but also the technology side. At the same time, have experience outside of that, have experience in entertainment, have experience in the communication world. So you bring a lot of pieces of a puzzle together and not creating just a generic response and generically dealing with things. It's actually
that's always great, right?
Here's a great idea, but experience in managing those kind of ideas and not being afraid to try something new. Exactly. And understanding when speaking to the clients, with a gentle touch, to understand that when they come to you and say, this is what I need,
right?
is the first thing I know is if that's what they say they need, that's the last thing that they need. But it's a buzzword they picked up. So it's working with them. Yeah, well, exactly. So it's working with them to sort of help educate the client as well as to really zeroing in on. Yes, there's a whole
makes total sense to me. I get it. So Howard, is there anything else you want our listeners to know?
Most immediately.
I like it.
I think more than anything else is not to be afraid of trying something different. There's a lot of fear. There's a lot of fear factor. There's a lot of fear factor in doing things. It's kind of like if you got an idea and you want to try something and someone says no, no doesn't mean no. No means they haven't tried it or they don't think it's not going to work. Doesn't mean it won't work.
100%.
And at the same time, just because you think something will work, don't think it automatically will. Fundamentally, check with your prospective customers and clients. Like, always do focus groups of one sort or the other to really make sure you're on the track, that you're solving a problem they need to be solved, but need to be solved now. It could be they need it to be solved, but it may not be. Where have
you been a keynote speaker at?
So you want to make sure you're zeroing in on what they actually need and what they need now.
Okay.
I've been at HIMSS a number of times, the American Telemedicine Association. I've actually spoken at Capitol Hill a number of times before congressional groups
you've been around
in the whole area of telehealth and health IT.
Hey, it's all good. Howard, I appreciate you coming on. I don't have anything else for you. I appreciate your time and coming on the podcast. And thank you. Definitely, Howard. Thank you.
Well, thank you so much for the opportunity. It's a great discussion. Thank you.